just come here, and actually like only one side fits to each. Like you can't put this side here, so just screw that in. Put this side on as well. So now we're good to go. Just make sure all of them are off so no water's leaking everywhere. So now we'll go to the spike. We learned 2 ways in class of spiking the bag. The first way is squeeze the bag so that majority of the air is out already. You'll squeeze it up almost to the top, as far as you can go, and we're going to spike it there. So then from that point, we want to fill this for the Swan Ganz. We want to make sure that this is full, as opposed to IV when it's only half. So just going to get that. So basically we'll be doing it till we get all the air out of that top part there. Okay, so I'm going to spike it. And you don't have to worry about the water here because there's actually an air filter in most of the ones that we use. And then we're going to pressurize. So you just want to make sure that it's open when we're pressurizing. And we're going to pressurize it to 300. Alright, so we're at 300. Basically what we learned here is that there's an air filter, so we don't really have to worry about the bubbling in this area. It's automatically going to do for us. At this point we can flush just the basics here, like we're not focusing on the bridge right now. So transducer, so what we learned is that this part, the purple side, always goes up. So when I put it in here, it'll be going to the patient. So we can start trying to flush these ports now. So first part I'm going to flush is here. I'm going to turn off to the patient so that it comes through and I can flush it here. I'm going to take off my seals or whatever they are. Flush.
Beautiful.
Good to go. And I'm going to turn it back on so that I can go to the patient now, and we're going to flush these ports down here. So I'm going to flush this one now, so I'm going to turn off to patient here, and I'll be flushing this port. We're good to go with that. I should have a cap here as well. There it is.
Capped.
Beautiful. And then lastly, we're going to flush to the patient. So open everything for this one. Open, flush. And we're good to go for that. Now we can start to set up the bridge. Yellow is always PA, so pulmonary artery. This is CVP, so central venous. This will be for, the white is for IVs, and this is for our cardiac output. So these two coming off will be going to the patient, and this is where we're going to be hooking up our system. So once we're hooked up, we actually have to make sure that every port, so 1 across here, 2, 3, 4, we have to flush all of them.
Perfect.
Okay, so first, right now, as you can see, wherever the arrows go, all the arrows open, so it's going to be going to pulmonary artery. So we're going to flush that first, make sure all my things are back on so that the flow can come to the patient. And I'm going to flush pulmonary artery first, so yellow. So once we're done that, we're going to turn off to the pulmonary artery.
Yep.
So now we can see that the flow or the fluid is going to be coming here, and the only way it can go is where this arrow is going. So we want it off here, and as you can see, it's off right now to CVP, but we want to flush that port, so we're going to be turning it that way so it comes through, and we're going to be flushing the CVP now. Now that we have that, we want to flush these two ports. So again, I'm going to do off to central venous, comes through, comes to this arrow. Since this is off right now, I want to turn it so that it is off here, and it comes through right here. So we're going to flush that. That's the IV port. Turn off to IV and flush right to the cardiac output. So now we're good. We're going to put it back into resting position. So as you can see, it's going to be off to the cardiac output. We're going to have it open to the nurse's IV line so that they can still be putting their IVs in. And open here and off to PA. So it's still going through the PA, and we can still be getting that pressure transduced from the pulmonary artery. So at this point, you have the option. Right now I can just zero my system. I'm going to take this port off. Obviously there's no water coming out, but what I'm just going to do is zero on my monitor, and now this is set with atmospheric pressure.
Also, you want to change this to the level of the phlebostatic axis, aka the level of the right atrium in which your patient is laying.
Yeah, and so now that we've zeroed that, the other option is, what I'm going to pass the cam, you could set up your cardiac output like with the whole D5W system, and then you could zero if you want to make it a closed system. And I'm going to pass it to Cam.
Okay, so this bag does not need to be pressurized because it is a bolus of D5W. Again, you're still going to want to try and get your air out of the bag. Okay, so my bag is spiked and it's now able to go into the syringe for a bolus. I'm just going to hang this bag. And then the syringe gets connected to your central venous port line, or your cardiac output line, which is in line with your CVP. Okay, and then you're basically going to want to go through a couple rinses of the syringe prior to giving it to the person. So you're going to want to have this closed before you draw anything up. Yeah, I'm just basically getting all the air bubbles out of the line here, so I'm going to want to draw some through each time. Okay, and as you can see, I'm just going to flush it again just to ensure that. Okay, and now that's set up. Close that off, and now this is set up for a bolus to determine your cardiac output. So again, your lines are color coordinated. So begin by hooking up your pulmonary artery line, and then your central venous line. Also, you want to check the function of your balloon. So by doing that, you're going to inject 1.5 cc's into your balloon.
Obviously, balloon's broken.
This balloon is broken, so nothing's going in, but we'll have to assume. And this hooks up to your temperature. So you want to flush your lines prior to giving it to your patient. So to flush your distal line, again your pulmonary artery or distal, you're gonna flush. The flush is over here.
Then you're gonna throw it here.
Okay, and as you can see, it's flushed. Okay. From there, you're gonna want to close this, knowing it's flushed. Open up your central venous line, and again, you can see the route of flow. And this will be through your proximal catheter, which is located 30 centimeters from the distal tip. Okay, and that's flushed. Okay, so now we will return back to resting position and show now how to do a bolus for cardiac output, and we're going to want to inject that bolus in the proximal line. So again, the blue being our proximal line. Okay, and it's going to be 10 cc's of D5W. You're going to want to open your line, and within 4 seconds, you're going to inject your bolus. Okay, from doing so, you're going to close your port and leave it in resting position. Okay, the final step is taking a mixed venous oxygen sample from the only true mixed venous part in your body, the pulmonary artery. You're going to need 2 syringes. One's used as a discard, one is used as your sample syringe. So you're going to want to uncap your flushed line. Okay, and then you're going to want to close it to your bag, open to your patient. Now you're going to take blood from the distal tip of your catheter. Okay. And this blood should be mixed with saline already in the line. This is known as your discard syringe. So now we have frank red blood in the line, ready to be sampled. We're going to want to take our sample, close it to all ports, take our sample off. This is our good sample. Return our discard syringe, close it to the patient, flush the line back into your discard syringe. Okay, so we know this is flushed. We're going to want to close our line to our syringe, remove our syringe, and flush back again to the patient.